All right. We will actually get started very soon because I have to wind the class up a little bit earlier today because I'm speaking in another group, an authors what is it? It's like an authors group on my book. Like it's her, she's an author training other people how to become authors. Anyway, I'm speaking about my book and I didn't put it in my calendar. And then she emails me yesterday and she's like, looking forward to you speaking tomorrow, blah, blah. And I'm like, oh, yes, so am I. I was like, shit, I forgot about that. So we're going to wind the class up a little bit earlier today. So we'll go straight through. We won't have a break if that's okay, but we'll get off earlier so I can go to my interview. But I live off my Google Calendar, so if it ain't in there, it ain't happening. That one was my fault. So, um, did anyone bring a urine test by any chance? No? Did you see my note? Oh, Beck did. Did you, Beck? You muted. Yeah.
But
Oh,
to be honest, I remember I sort of kept forgetting this morning, but then I was like, oh, how much sesame oil did you say?
yeah, just a drop. Did you do it?
Yeah.
And what did it before? Because we'll get into it. So what did the oil do when you dropped it in the urine?
Well, first it was all like all little drops, but then now it's just gone to the side.
Yeah. So when you dropped it in, it went into all little drops, did it?
Yeah.
Like bubbles. Okay. Take note of that for when we get to that part of the class. Awesome. Thanks for doing that. That's
Sorry,
exciting.
Harmony, just to clarify, because I missed the memo.
Yeah.
What was the request? A urine sample and then dropping a drop of sesame oil in the sample?
Yeah, I just wrote it in the Facebook group. I forgot to add it in the email because I thought of it after.
Yeah,
And then I was
okay,
like,
cool.
if you can catch like a midstream urine sample and then you drop a little drop of sesame oil in the urine and just observe what that sesame oil does. Because
Gotcha.
a diagnostic tool that we will get to
Yeah,
today.
and is this specific to the Schroeters? Because we
No,
talked.
it's specific. Well, one of them, yes,
Yeah,
but it's specific to the doshas.
yeah, gotcha. Okay,
Yeah.
cool.
Yeah. All right. So, as I mentioned, we'll get started because I do have to leave this class. We have to wrap this class up a bit earlier than normal. Um, so I'm going to share my screen, advanced portion of screen, share. All right, um, okay, we can stretch this out and pull it down. How does that look, guys? Does that look good? Thank you. Thank you very much. Excellent. All right. So we last week we started the this module on diagnostics and assessment, and we went through all of the datus. I feel like I don't know if my, hang on, I'm trying to make it. Ah! And that always happens when I click off and these disappear. I'm not going to play with it. Okay, so today we're looking at examining the Schroeters. So in the module before this one, we did learn all about the Schroeters and we learned all about the datus, the tissues. Remember, Schroeters are the channels of the body. And so now in this module, we're going to learn, now we know what they are, we're going to learn how to assess them for dis-ease and how because once we know how to assess something, we can then create a treatment protocol for it, right? So we're going to look at how Ayurveda specifically examines the Schroeters, or as we call them, the channels of the body. And excuse me because of my voice today and my face is all snuffly. It was my birthday on the weekend, and no, I didn't party hard. My child gave me the gift of his flu or cold. So I'm just recovering from that. So if I get a bit nasally, that's why. But anyway, we know that the Schroeters, they carry substances like the malas, the prana. Some of the throaters carry the waste. They are the channels of the body. So one of the easiest ways I find to assess the health of the schroter is really by examining the flow through it. And do you remember in one of our modules, we also spoke about the flow through the schroters, whether it's excess or deficient, whether there's a blockage. So we really want to assess what is flowing through and how it is flowing through. So, for example, the Rasa Vaha Shrota can be assessed by looking at a person's hydration and the plasma quality. So obviously, I'm just going to move your faces over this side of my computer. Sorry, I'm still organizing myself here. Um, because if I look, oh, now I'm taking photos. Oh gosh. I'm looking at you. You're all over here, and I'm looking at my camera here, and it's like trying to see your faces and read
Ha-
stuff.
Harmony, did you want to do the chant before we start?
Oh, thank you. Would you like to, Beck? Thank you so much for reminding me. Let's do that.
Maybe next time I'll do it. I don't know.
Yeah, let's do that. I forgot
Sorry.
last time too. I just dive in, don't I? I get so excited about
I
the
know
content.
you're in a rush, but let's do that. That's always nice.
Thank you.
Would you
Let's
like me to do it, Harmony?
oh, is Jasmine on here? Yeah.
Yes, sorry, I was a few minutes late. I got a quick
Oh,
phone call.
thank
I
you.
got
I'm just
jumped
still trying to organize my screen.
in.
Okay.
So we'll settle in and find our seat.
Yeah, settle in,
Mm,
Harmony. Settle in.
Settle in. Find our feet, find our seat, find our connection with the earth, connection with the elements. Perhaps we'll connect with the elements before we begin this chant through our senses. So noticing the sounds as they arrive at the ears, noticing the smells through the inhales and exhales, noticing the felt sense of air or wind or breeze or warmth or heat on the skin. And with the eyes closed, perhaps looking at the third eye, the space between the brow, and noticing if there's a pulsation or a light or a darkness, any kind of energy, frequency, vibration that is abiding there. We experience the world through our senses, and if we stop and listen just for a moment, can we be aware of even our blood pulsing through the veins, of our breath, our prana? They say meditation is a meeting of our own energy. Can you meet your energy in this moment? Without trying to change or fix it, simply meet it. And as you meet it, can you welcome it? Even if there's pain, even if there's contraction, can you just welcome that space right here, right now? Taking some deep inhales and exhales. All of the senses alive, awake, aware. Our whole body, spanda, the breath in, the breath out, the pumping of the blood, the pulsation of the optic nerve behind the eyeball. We'll invoke Lord Dhanvantri today as a remembrance of the healer within each of us, within ourselves and ourselves. Beginning the chant, Om Dhanvantri Murtaye Namaha. Om Danvantra 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 Murtaye Namaha. And a whisper, Om Danvantra Murtaye Namaha. Allowing the chant to land in the heart, the seat of consciousness. Shanti, Shanti, Shanti. Peace, peace, peace. Namaste.
Namaste.
They
Thank
say
you.
there are three stages of sound, and the first stage is what you can hear. So you can hear Om, right? And the second one is like a whisper, and the third is the thought of Om, and which is more powerful? It's an interesting inquiry, but you'll find that thought is sometimes louder than sound. So remember, keep your thoughts kind, because they are listening. I don't know. Perhaps somebody needed to hear that today. There you go.
Thank you.
Little
I think
bits
we
that come
always
out of nowhere.
always need to hear that.
Thanks, guys.
All right, now we feel nice and grounded to absorb the wisdom and the information of Ayurveda. And even I feel more grounded to be teaching. So thank you for reminding us, Beck. I did say remind me because I get so excited about the content, dive in, and yeah, we've always got to first ground ourselves in anything we do. So it's a lovely way to start. So thanks, Jasmine, for doing that. Okay, so back to examining the Schroeters and looking for clues of how they are working. And like I said, when you're looking at the contents that flow through the Schroeters, that can give you a good clue on how the Schroeters are actually functioning. Because if the quality of the substance that flows through them is like of good quality, then usually the Schroeters are with intact, unless there's sort of like some sort of blockage. And then therefore the amount of what's flowing through wouldn't be getting through. So we wouldn't see that quality. So the Mutravaha Schroeter, that is the Schroeter, we're looking at the urine. So we're looking at clarity and color and odor, and which is why we'll be doing the urine test a little bit later. Oh, sorry, I forgot the Raktavaha Schroeter. So that is looking at the blood, the viscosity of the blood, as well as the color of the blood. And then we have the Purushavaha. So that is where we observe the stools, so the feces of the body. What is the form of the stools coming out of or passing through the Shrota, the consistency, how regular is a person passing their feces, because that will give us a clue on how this Shrota is functioning. Um, so we really want to learn to assess these channels or these schrotas because the health of the body depends on proper flow through these channels. So you can see prana, blood, plasma, waste, all flows through these channels. Every tissue substance, every nutrient, every waste product and life force literally moves through the schrotas. So when a schrota becomes blocked or weakened or excessive or depleted, the tissue that it then nourishes begins to malfunction. Yeah. So by assessing the contents of the schrotas, such as the stool, the urine, the breath, the blood, the reproductive fluids, we can then start to identify which dosha is disturbed or perhaps disturbing the schrotters or the dhatus. We can detect early signs of disease before tissue damage occurs in many cases. We can determine which tissue system or which dhatu is also affected. We can understand the direction of the pathology, and therefore we can develop a targeted treatment plan. So we're going to have a look at each of these schrotters, what a healthy, normal schrotter would appear to be, and then the influences of the doshas on that schrotter. So the Anavaha Shrota, it refers to the digestive tract, particularly the stomach and small intestine. So when we see the Sanskrit term ana, so A-N and A, what is that telling us? Anybody? Unblock, unmute your mic.
Sorry, what was the
It,
question again? How many?
so Anavaha Shrota, the term ana, what does that part of, when you see that in a word, in a Sanskrit word, what is that referring to?
Okay, so you're saying Anna or Amma?
Anna,
Anna.
Anna.
Anna,
Okay.
na,
Okay.
Anna, Anna Vaha Shrita. So if we see the
It's
word,
food.
it's food. So Anna, whenever we see Anna, we know it's food. Like I say, we're learning many languages at once in here. But just so if we see that, and we're like, oh, okay, we know we know Schroter means channel, or we know Anna means food. So it's like the food channel is what the Anavaha Schroter is. So it's referring to our digestive tract. In a healthy state, the mouth and the throat, it should not be excessively dry or overly moist. Like you don't want a lot of salivation, but you certainly don't want it to be really dry. And there shouldn't be any inflammation or abnormal secretions. So that's what a normal anavahashruta should appear to be. But when it's imbalanced, when one of the doshas enter this channel, it can appear different. And so when vata enters the Anavahashrota, it tends to become really dry because we know that is one of the main qualities of Vata is the dryness. So the mouth will be dry, the throat will be dry. When Pitta enters the Anavahashrota, then it will create a little bit more redness and inflammation. So if we like had a tongue depressor and we looked in someone's mouth and we can see red and inflamed, we're like, okay, so there's pitta has entered the anavahashrota. And then if we were to observe kapha in this shrota, it would lead to excess mucus. So a lot of mucus going on. So for moi, who has had, who is I'm a pitta like more Pitta Vata, but at the moment I have an imbalance of Kapha in my Anavahashrota because it's entered. I've got more mucus build up through my throat. Yeah. So we would be treating Kapha for me, even though that might not be my sort of natural prakriti, how I present all of the time. Okay, when we are also talking about the Anavahashrota, now we can also pay attention to stool changes, even though we will be talking about the Prushavahashrota later, which is the stool one. But when we bleed, if there is any bleeding higher up in the digestive tract, this can actually cause black or tarry stools. So if there's any upper GI bleeds going on, which is um, quite important to know and understand because that would mean that we need to refer this client on. Then the stools can become really tarry and black. So that's usually a sign of blood higher up in the digestive tract, whereas lower down, say there's some hemorrhoids or lower bleeding in the colon, then there might be some red blood in the stool. Yeah. So if we were to examine the Anavahasrota as an Ayurvedic practitioner or consultant, we can only really sort of like look in the mouth and we can only see so far. In clinical medical procedures, they will look with a gastroscopy or an endoscopy so that they can have that direct visualization into the digestive tract and they can look for ulcers, inflammations, or growths. So again, if you're suspecting anything like that, you may be referring this client on if it hasn't been able to be treated um, and managed through their uh, Ayurvedic treatment protocols. But if there is any blood in the stool or black tarry stools, I say always refer those clients straight on. Which brings us to the Parishavaha Shrota. So this is the Shrota that relates to the colon and the elimination of our stools. So what does healthy poop look like? There's naturopaths and nurses in here, so I'm sure hands up who's looked at the Bristol stool chart. Yeah, Christy's seen it. Yes. Oh, hi, Christy Sinclair as well is in here today. Hello. Hi. Um, have you seen the Bristol stool chart by any chance, Christy Sinclair? You have? Yep. Amazing. For those who haven't, I might try to find it online and pop it in the Facebook group, but it really tells us what our poos should look like. And so a healthy stool should be light to medium brown. It should be well formed, easy to pass, and ideally, it should float a little, okay? However, different doshas will affect the stool as well. So if Vata has entered the Purusha Shrota, so this channel, then it can turn the stools quite like a dark brown or grayish color, and often small dry pebbles or pellets like sheep poo. Has anyone seen sheep poo? Is anyone not an Aussie or a Kiwi here? Or Helena's a Brazilian, you've seen sheep poo. We've all seen sheep poo. Okay, good. So that's kind of like what the Vata poops might appear to be like. Whereas a Pitta, they will produce softer stools with a stronger odor. And when the Pitta has entered the Purisha Shrota, then the stools may have more of a yellowy, greeny color to it. Again, if there's upper GI bleeding, they'll be black, or if it's lower GI bleeding, there could be red in the stools, which is more fresh blood. Now, if Kapha has entered the Prishavaha Shrota, then they might have more of a whitish, palish parts of the stool, and that's possibly because of some mucus strands that are in the stool. They actually would have larger, heavier, log-like stools that come out, so a larger amount. And again, always just looking at the color to not only see the dosha's um, impact on the stool, but also we do want to be mindful if there is any blood in the stool. So whether it's red or whether it's dark, like black, they can both indicate that there's been some GI bleeding. And in modern medicine, those clients would tend to go off to have a colonoscopy so that they can see right through the Purusha Vahashrota. Even if they might call it something different, that's what they're looking at. Now, examination of the Mutra Vahashrota. So this is the urinary system, right? Now, what does healthy urine look like? Well, it should be ideally clearish, like a light golden yellow in color, and have minimal odor. And as you see on the screen, on your notes, it says have little taste. So, yeah, traditionally in Ayurveda, as part of their examination process, there would be some urine tasting going on. We do not advocate for that and we do not do that. So, no need to taste any urine, okay? but it is sterile, light golden color, and little odor or taste. Now, different doshic patterns can show up in the urine as well. So, if Vata has entered the Mutravaha Shrota, then the color could possibly be a more darker yellow because they can often be really dehydrated. So sometimes it can be like that, or a more of a grayish color. Um, they could have really scanty, atypical um, urine, so like going sporadically, but really small, scanty amounts, or they can have a really sort of large volume rate and it can fluctuate between the two. There's not a lot of odor. It's more um, clear, but in those color tones. And again, the taste is quite mild. And so if pitta has entered this Shrota, it can be more of that really sort of bright yellow. It can have a greenish hue, or sometimes there may be some blood in the urine. It will have more of a strong, pungent smell, and if you were to taste it, just in case you wanted to know, it would have a sharper taste. And then kapha, they would have more of a pale color to the urine. They would have a large amount. The odor would be more of a sweet smell, and it can look a little cloudy. And again, there can be some mucus in it. And if you were to have a taste, it might taste a bit more sweeter. So, from a medical aspect, we would usually do a urinalysis or a dipstick so we can look at the different, if there's sugars or bloods and ketones and all the things in the urine. But from an Ayurvedic diagnostic tool, we would do the oil drop test, which we are going to have a look at. So, one of the lovely students today, Rebecca, has come and reported that she has done her oil drop test if you missed the start of the class. So, Beck, I'll explain how we do it and what it means, and then can you let us know what you believe your urine test mostly represents? So, the oil drop test, it's a traditional Ayurvedic diagnostic method. And this is where you place a drop of sesame oil into a urine sample. Now you want to take your urine sample midstream, so you pee and then you pee a bit out and then you catch that sample if you can. And then once you drop the oil into the test, you observe how it behaves because the movement of the oil will indicate the doshic dominance in in this rota. So if it's vata, so you drop the oil in, the vata, the oil will spread out like a snake with branches, like slither like a snake. And also that is how when we get into pulse testing, we also feel for the vata pulse as well. But let's stick on the oil. The pitta, the oil stays round, but it slowly expands. And then the kapha, the oil remains round like a pearl, or it starts to split into little pearls. So I think, Beck, you said when you first put it in, it sounded like it split into little pearls, did it?
Yeah, I think so.
Yeah, yeah. So at the moment, it's showing that there's probably more kapha in the scrota. Now, if the oil sinks, it's traditionally considered a sign of a poorer prognosis. And so if it floats, then it is yeah, easier to treat or is not as bad. Also, some texts say, and Helena, are you on the belief that if it sinks, there may be more armor present as well?
That's
Yeah,
what I learned. Yeah,
yeah,
if it
same.
sinks them.
Yeah, so if it sinks, there's more armor present that you need to treat. Um, so I mean, this test isn't used a lot clinically these days, but you can certainly use it with your clients, and you would use it if they were coming to you specifically with any urinary tract uh, um, signs and symptoms. So what before we move on, I would love for everybody to just have a go at doing the urine sample test, the oil test, and if you could just report in the Facebook group what you found, because it's always interesting to learn from each other as well. And it's just a good observation tool. Okay, so now we're going to examine the sweat, the Sfera Vahashrota. So we want to, when we're examining this Shrota, we would like to look at the volume of the sweat, the smell of the sweat. So if the sweat, the sweat is produced in accordance with the states of the rasa and the metas dhatus, and then it's carried through the Schroter once it's released. Yeah. So the sweat Vahashrota is the channel for the sweat to flow through. When we're looking at the volume, it's really very hard to, I guess, evaluate other than the patient's subjective experience. So we need to ask questions, inquiry about their sweat. And then, as the examiner, as the practitioner, as the consultant, you may be able to rely on smelling the sweat if they are, in fact, sweating and if they haven't doused themselves in perfume and deodorant. If you can't, you'll also be asking questions about the smell of their sweat to determine their health. So, healthy sweat is it can be moderate in volume, but it doesn't have a lot of odor, okay? Whereas when the different doshas enter the Schroter, you will see that Vata, they have very little sweating. So there's not a lot of sweating, there's not a lot of odor. Pitta, they will have excessive sweating and they usually have a really strong odor. Whereas the Kapha, they can have a large volume, but it'll have either a mild or more of a sweeter sort of smelling sweat. It won't be as pungent as the Pitta. So these patterns, they also help us to understand metabolism and thermoregulation of an individual. So what their constitution is like metabolically and through the thermoregulation. Okay, so now we want to look at the Pranavahashrota. So what is the Pranavahashrota? Someone think yes. Who's answering? Think what's prana?
Breath.
Yeah. And what does Shrota mean? Channel, yeah? Breath channel. Yeah. So it's the respiratory system. Perfect. Yay, we're learning our Sanskrit. Love it. Okay, so it can be really sort of difficult to observe the respiratory system, as in looking into the respiratory system, because we're not looking into the lungs or anything unless we have x-rays and so on. But we assess the prana of an individual and we assess the flow of prana, the flow of breath. So um, with a healthy system, there's not going to, through this Shrota, through this channel, there's not going to be a lot of mucus production, right? Because they're healthy. When Vata enters the Pranavaha Shrota, there could be, if there was mucus, it would be very minimal. It would be more hard and dry and more of like a grayish sort of color. If there was pitta that entered the respiratory system and there was sputum that had been coughed up, it would look more yellow or green. There would be a moderate amount and it would be more soft and oily. Whereas kapha sputum is more white and it can be more large in quantity and it would again be more soft and oily. So we can, if the client may describe their sputum, that they've been I've been coughing up these big yellow green goobies all day. and I've got really sore throat, then you're going to know that that pitta has entered the pranavaha shrota. Whereas if they've got a really dry cough and there's not really any sputum coming up, or if there's a little bit of dry hard, then we know vata has entered. Or if there's a lot of copious sort of white mucus coming up, then we know kapha's entered the pranavaha shrota. So yes, that is that. Okay.
Sorry, Harmony, can I just
Yeah.
ask a question about that respiratory aspect
Yeah.
for um when when assessing the respiratory channel and because in the Western we use the stethoscope and listen for crackling. In terms of Ayurveda, do you go through that process? Because being a nurse, like, how do you link that crackling, or what would you relate that to in terms of the imbalances with the doshas?
Yeah, so if you have that in your practice, you can certainly add that into your practice because it's already in your scope. So if you're someone who is a naturopath nurse and you've been trained to listen to the chest, then you absolutely can. And so if you were listening to the chest and there's more crackly, if it's a dry crackly sound, then there's more vata going on, or even more if there's like this wheeze, then there would be more of a blockage of that the pranavaha shrota, because a wheeze, especially if it's an inspiratory wheeze, is a closing of the channel.
Yep.
So there would be more like of this sort of blockage happening. However, that could also indicate inflammation. So there could be some more of that sort of pitta inflammation. So whilst you're listening, and you might find that there is some crepitus in the sound, and they're breathing like this, and they're hot to touch, and there's redness, then you're going to know that you're listening more to a like a pitta type. So that's where the inquiry comes with the listening and the observation. You bring all of the skills together.
Okay, cool. Thank you.
Whereas yeah, you can really hear that thick kapha mucus sound. You know what I'm talking, like that
Yeah.
that cloggy sound, sticky sound. Does that make, yeah, when you're listening,
Yeah.
you know you're listening to kapha. Yeah.
Thank you.
You're welcome. Nicole.
Does the breath, does that still also include the nose and what kind of mucus you're going to have there?
Yes, yeah.
Yeah.
And also what wasn't on the slide is observing obviously the breath as well. So that's a very good point. So how are they breathing? Are they breathing up here? Are they kind of like anxious breathing up the top?
Yeah.
Do
Mhm.
they take long, deep, slow breaths? Like, how are they breathing? How are they utilizing the prana? And again, when we look at are they getting enough prana in? So, how are they utilizing the way that they breathe? And how are they exhaling? So, that's really important to observe their breathing patterns as well. And does anyone know what breath per minute, what the average breath per minute is for a person? Christy, I'm pretty sure you've cheated on your nurses observation sheets before. Have you? Come on, we've all done it where we just write the number. We write a good 10 there or something. So, you've got to observe the breath, and in a minute, what most people say and most people fudge is they'll say, oh, yeah, they're breathing like 10 breaths per minute, but really, or 10 to 12, but really that's too many. Like, the average person is over breathing and then not getting the adequate amount of prana. Really, we should be doing like 6 breaths per minute if we're properly breathing how we should be breathing. It's an inhale for 4, exhale for 6. Really, but we're not breathing
Don't
like
have
that.
time for that, Harmony.
Yeah, we don't have time for that.
I've
Let's
got
just
to
keep
breathe
breathing through
fast.
this. Yeah. So just looking at the breath rate can tell you a lot about the persons. Yeah, the pittas won't have time to breathe properly. The vatas will be breathing up here a bit like, what's going on? The kaphas, they'll just be, yeah, they'll be chilling. They'll be chilling. They'll be breathing. They're good. Okay, so the next one is Atavaha Shrota. Does anyone know what that Shrota is? What are we assessing here?
Reproductive?
Yes, we are.
Reproductive?
Yes, thank you. We are. And so with a female, the healthy vaginal tissue is slightly pink, and everyone hates this word, but I really don't know another word to describe it. Pink and moist. Like, has anyone got a better word? That's healthy, right? Um, Without any sort of lesions or really heavy exudate of any kind, that have a regular menstrual cycle, in conjunction with their sort of what dosha they are as well. So regular and normal cycle looks very different to different people, and that's okay as well. It doesn't have to be textbook normal. I want to make that clear. But it doesn't have the extremities of those doshas. It just has normal for that constitution. So we can tell a lot about about this Schroter through the menstrual blood as well. Also through the wall of the vagina. So if there's a lot of vata that's entered this Schroter, there could be more of a dry, rough vaginal wall, whereas a pitta might have more of a inflamed or hypervascular wall, and a kapha will have more mucousy, pale, or like muscular, would you say, wall? Um, and then when we're looking at the volume of the menses and the presentation of the menses cycle, if Vata's really entered this Shrota, there might be a lot of dryness. So they might have scanty and light periods, but the blood could be a little bit darker. And they might have shorter or really irregular cycles. So they might have like a 24-day, then a 35-day cycle. It can be quite irregular, the cycle. And then if we have pitta enter this, like if we're looking at the menses of the pitta, they can have a lot of heavy bleeding. There could be a lot of inflammation going on throughout their cycle. They could have quite a bright bleed as well, that goes on. And then kapha, oh, and also with pitta, they're usually quite cyclical, but they will have their bleed will be from that sort of 3 to 5 day period, whereas vatas will bleed less in their active bleeding period, and kaphas usually bleed a little bit longer, and they can have a moderate to heavy bleed, the kaphas, and sometimes there's there might be some clotting in there, some stagnation, and they can also have some mucus in there, or they could have mucus plugs, clotting, and like a more of a purplish type of blood, because that's sort of like the stagnation sort of moving through then. Um, when it comes to discharge as well, so vaginal discharge, that can also tell us a lot of signs about the dosha imbalance or the dosha involvement in the Atavaha Shrota. So vatas will tend to produce more of a thin grayish discharge color throughout their cycle. Now remember, discharge will change throughout the cycle, regardless of your constitution, usually. And your highest amount of discharge will be around your ovulation. So you have that ovulation fluid. And we'll go all through this in the women's health module. But just in general, a vata will have less fluid and more thin and more grayish discharge, whereas a pitta might produce a little bit more of a yellowy tinge or a greeny tinge, and maybe a bit more of a musty, stronger odor. However, if that turns into actual yellow, actual green, and actual strong odor, then they need to be referred on, because that could be a sign of an infection. Kapha will tend to produce more of a thick white mucus-like discharge. So, here we go. It says it all here. So this is the chart for the discharge. I'm just seeing if it says anything different to what I said. Yeah, so kapha, it does say it could have that yeasty smell as well. Amazing. Okay, so the Sanyavahashrota. Does anybody know what that one is? It's a little bit more trickier because it's not one we talk a lot about. We mentioned it being an apadatu. Um, yes, Nicole's
Milk.
she's pointing to her milk jugs. Yes, it is the milk. It is the Schroeter of our breast milk. So so normal, I'll start with normal. Milk is produced on demand with adequate volume to meet the baby's needs. Smell and taste are mild. It can be slightly sweet. The color is white, but it's not too oily or dry. And there can be mild variations of this quote unquote normal milk production depending on your constitution. However, when there is an an excess of that dosha in this channel, it will have those variations. So when vata enters, it will have much more of a grayish tone or color to it, the milk. The smell will be still mild and taste mild, but it could be really scanty volume and it's very difficult to meet the demand because there's more dryness in the vata constitution. The pitta, the milk might have more of a yellowish tinge to it. It could have a really strong acidic or sharp or unpleasant taste to it and smell. It could be a little bit more oily, the breast milk, and they often have just that moderate volume. Whereas a kapha has entered the Stanyavaha Shrota, there could be more of a cloudy or a peak observation to it, more of a sweet smell and taste and more of that slippery sort of oily appearance and even to touch. And they would have higher amounts of volume. Okay, now we're getting through them, guys, but doing very, very well. And I believe this may be the last one of the Schroeters, but we're going to now talk about the Manovaka Schroeter. So let's break it down. Mano, Manas, what does that mean? We know the Schroeter is a channel. So what is when we see mana or mano in a Sanskrit word, we know that it's got something to do with the mind. Yeah. Yeah. So when we're observing the Manavaha Schroeter, it's can't really be examined by direct perception. However, it can be observed through the pace of the voice and the way that somebody speaks, because the words a person chooses and the intonation of speech can shows us how their Manavahasrota is perceiving information. A thought precedes speech, and then therefore speech can be used to assess the Manavahasrota. So how does it appear like normally where they're speaking not too fast, not too slow, they're speaking clear, they're calm, somewhat melodious, but of course there will be variations to this depending on their constitution. So we know naturally a Vata person is more active in their speech. They talk with their hands, they're more quicker, they can jump from idea. That's more of an imbalanced side. Pitta is very strong, very sharp, very articulate, very clear, whereas a Kapha is more soft, more slower in their speech. So when this Vata dosha comes and dysregulates the Manavaha Shrota, a person's speech will become a lot more faster and they can begin to ramble. So those people are going blah, 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 and start rambling. And there's often a loss of linear cohesion to a conversation. Have you ever had a conversation with someone and they're going, yeah, yeah, blah, blah, you know what I mean? And you're like, no, I don't know what you mean. I don't know what you just said. Like, come at me again. This is like Vata going on in the Manavaha Shroda, and it reflects an increase in the speed of thought, but the lack of the coordination of that thought. I can see some of you going, yes, I know somebody very much like that. And you going, me, Chrissy Lee's going, me. And the words chosen, maybe words of caution, because of that, there's an indication of fear. Because remember, Vata, one of the imbalanced emotions can be fear. Or on the flip side, other words that express through the mind of Vata can be with great enthusiasm and drama. So they may use a lot of words like, oh yeah, that's so awesome, fantastic. Oh my gosh, that's outrageous. Oh yeah, great. Like they're really like that enthusiastic and got a lot of emphasis and drama behind it. But when Pitta enters the Manavaha Shrota, a person's speech will become more focused and intense. And the quality of the speech can become more sharp and also fiery. They can like be boom, boom, and they're the ones that are speaking to you and they're getting fired up and you're like, ooh, ooh. Like a bit scary. The words that they choose can often be really combative and might be filled with judgment. So, yeah, they can be quite, you don't want to get in a verbal conflict with Pitta because they're like, pfft. Then when Kapha enters the Manavaha Shrota, the speech will slow down and a person will speak less. Answers to questions need to be drawn from the patient a lot of the time. Like you're drawing out the answers. You're like, give me more. Tell me more. Whereas when you've got a Vata, you can tell as soon as the Vata sits down in front of you, you're like, oh gosh, this is going to be a lot of work trying to keep them on track. They're like, yeah, and then yesterday, my mum's brother's sister's dog went to the vet and and that affected me because, and you're like, okay, what's your menstrual cycle like though? Remember that was the question? And so you got to keep drawing them back. Whereas the Pittas will give you this like excellent A plus answer, and you're like, perfect, great, tick, let's go to the next one. And then Kapha, we're sort of drawing that information out. And this kind of reflects that dense, slow qualities of the earth and the water. And their tone is often soft and their words are they're sweet. They're nice. Kaffers are Kaffers are beautiful people. They're nurturing, so they have nice words to say. Yes, Amanda?
Just out of curiosity, and probably more from a personal perspective, when you've got these imbalances in this particular Schroeder, what are some of the strategies that you utilize? Because if we're talking about being in front of a client as well, and we're seeing this, and then so let's say I'm Pitta, right? And then if you've got somebody that's really Vata, what are some of the strategies that you use to try and recalibrate and balance to come back in and have a conversation, especially when you've got Pitta and Vata in the same room? I'm Pitta Vata, but probably
Yeah.
vice versa.
Yeah, sometimes you need to adjust your tone to try to bring them back to your tone.
Yeah.
But again, like a great example of what happened. So I was very Vata when we started. I've been like rushed around this morning, doing my things. I come here, I'm like, yeah, I'm getting into teaching. Yeah, guys, so I've got to go. I've got to do this and let's get into it. And then Bert's like, we didn't do the chant. And then Jasmine dropped in and did the chant for us. And so sometimes it is like literally dropping them in. If you know that person, if say you've had them before and you know what they're like, you can also go, okay, we're going to start with a bit of breath, a bit of grounding, and get them grounded before you go into a session with them. But often if it's their first time and you don't know them and they just sort of start, I always go, okay, and redirect. So if it's a Vata, I'm always redirecting back to the question and just reminding them, we've only got this amount of time. I really want to make this the most beneficial for you. So can we just get back onto this question? So it's a lot of redirecting. And then it's also sort of maybe slowing down your voice and slowing down your energy so that they're sort of drawn into your energy as opposed to you being drawn into their energy. If they're Pitta, I I don't have I think Peter's are quite good to interview and to do consults with. The only thing is that when you get to the end and they want their protocol and they want more and more and you're like, no, I don't want to give you more and more. And you've got to remind them that this isn't about perfection. And so it's constantly about bringing like a bit more passion and a bit more fun and a bit more joy. And sometimes you need to do that into the conversation as well and lighten the mood up for them, lighten it up. Yeah,
Okay.
yeah. Whereas the cuffers can feel a little bit stuck. And yeah, they could be really, for us, it can be a little bit more challenging interviewing a cuffer person because you you have to be patient. We, as the practitioner, have to practice a bit more patience if you're a Vata Pitta practitioner. Yeah. Did that answer your question?
Yeah, thank you. Thank you.
You're welcome. Nicole?
What about people who know what they're normally like, but put on a hat and come across something different to what they are? I'm real
Yeah.
good at that.
Oh, so you're saying for yourself,
For
you do
myself,
that
I'm really good at that. So, how do you deal
with people
with
like that?
someone that you're interviewing that
Yeah.
initially you think is this, but they're coming across as that, but actually they're that, but the more they talk, they sound like that.
Yeah. And that's where your skill of inquiry comes in because once you start picking those type of things up, you will learn to ask even better questions, and the quality of the questions that you ask will determine the outcome that the client's going to get. But again, we have to always remind the client, like it's in their best interest to give us all of the information that they can provide because we're there to support them along the way and help them as
Yeah,
much as possible. And
yeah,
so if they're being really open and upfront and honest and just being who they are, we
yeah,
can get better results for them. But
yeah.
also, well, not for them, we can give them better protocols and options and they can get better results for themselves. So that again, though, if you were going down the Manavahasrota route and the Ayurvedic psychology route and all of that, you'd also be asking questions, maybe not in the very initial consult, but later on, like, why do you feel you have to put on this hat here? And where has that come from? What part of the seven layers of Ayurvedic consciousness are you actually working through most of the time? Because, yeah, then I would be looking at a bit of a blockage or a bit of a dysregulation in the Manavahasrota. You're exactly right. So we need to, then I would be taking that back to sort of looking at the root cause of that because we're always looking at that. Because once we can free that emotional blockage in the Manavaha Shrota, we're allowing more prana to nourish the mind. We're allowing the person to really step into their truth, their essence, their higher self, which is what all of this is about as Ayurvedic consultants and practitioners, is helping everyone to get their optimal health and well-being so they can step into their higher self ultimately.
Okay. Yep. Thank you. It's really interesting for myself, particularly. I'm a particular type of person,
Yeah.
quite quiet and everything. And with my work, I have to step out of that box. And
Yeah.
sometimes, that comes across when I'm being interviewed and that when I know that I need to be slowing down and just being who I am. It's really quite difficult sometimes when for many, many years you've had to step yourself outside of that square and
Yeah.
like I said, put on a hat.
Yeah, and
Mm,
absolutely, and sometimes we certainly are putting on a different hat and like being or trying to be someone we're not, but we also do have a lot of different aspects to ourselves and to
mm,
you know, us as people, and we do have different hats that we sometimes do put on, and it doesn't mean it's not us. It just means that it's reflected differently. Just like we have
yeah,
all three doshas within us, we have all three, and sometimes they play out in different aspects of our life in different areas. But it is really important to be aware. And if you're already aware of that and you're saying I put on a hat, then it's probably the other option of that, as opposed to accepting all parts of who you are.
mm.
That's certainly something you could discuss with your client when you're going down that path.
Mm. Okay, thank you.
Welcome. Christy Sinclair, I saw your hand up. Did you have a question?
Hi.
Hi,
Um,
nice to meet you.
yeah, I will just say that I'm catching up to
Yeah.
everybody. So I'm actually halfway through the Schroeters
Yeah,
at
awesome.
the
Yeah.
moment. A little bit ahead. But yeah, my question was somewhere along the lines of Nicole's, just of that deciphering that I know for myself personally, I can swap between sharp drive, pitta,
Yeah,
and fluctuate between the three in one conversation based on topic and my interest and my
absolutely.
engagement. And then as well, other people, like clients that you might be talking to, have a somewhat skewed interpretation of themselves as well. So they believe they're seeing something in themselves that we're seeing something very different and situational too. So that was great to bring up, Nicole. So thank you. And I think your answer already covered a lot of my questions. So thank you.
Yeah, no, you're exactly right. They do have skewed perceptions of themselves, especially if they have been told their whole life that they are this certain person. And there can be when we get into Ayurvedic psychology, which I actually think might be our next subject, is they've got these samskaras because maybe as a child they've always been, maybe they were quite creative and vata and extravagant, and then they were shunned for being like that and told to be quiet, and children should be not heard, they only seen not heard, and so they had to become a shell of who they actually are. And so now they've got a samskara as they're this sort of quiet nobody, and that will be activated because a samskara is like an imprint in our chitta, our subconscious mind, and then that's how they're going to be activated when they're put on the spot. So they're in front of a practitioner and they're like not saying they're really guarded, they're holding themselves. But when we actually unravel those samskaras, then we find that they're able to be themselves, a little bit more of that essence of who they were, which is actually this really bright, open person can finally come out. So it is really intricate, the relationship in Ayurveda with the mind and the doshas and the body and how they present. And it takes skill and practice and time and really good inquiry and observation and all of the tools you're learning. And it starts to just slowly unfold person by person. So, yeah, good questions, guys. Love it. Did I finish this one? Yeah. Okay, so what does it say? It says, listen closely to the patient's voice when doing consultation and provoke the patient as needed to bring out tendencies. So not like stabbing a sleeping bear. I guess that means more, again, asking the right type of questions. I often also ask about like personality traits, like when you were a kid, were you like this or like this? If we're looking sort of more at a prakriti sort of looking at that, and then like, and what are you more like now? What do you like in the workplace? And you're sort of like asking all of those type of questions to see if they do some masking, which Nicole was talking about. Okay, so this is just a really quick overview of the Schroeters, all of the Schroeters, and the signs of the Schroeters in the signs of the doshas in the Schroeters. Oh my gosh, did I say that right? So, for example, Rasa Vaha Schroeter, we know that it carries the plasma, the lymph. If the Vata signs in the Rasa Vaha Schroeter, there's going to be dry skin, there's going to be dehydration. Pitta, there's going to be redness, inflammation. In the Kapha signs, there might be fluid retention and edema in the body. Rakta, the blood. Vata signs, cold, pale, pitta, heat, redness, kapha, more thick blood and stagnation. And we actually see this on a side note when we do like the body works therapy, and I teach the cupping, is like how you can read if there's stagnation, heat, or more of the coldness in the body just through applying some of the cups, because there will be more redness come up and heat if you when you're using the cups in more of a pitta. If there's kapha, it'll be like a purple bruising, that's stagnation. And then vata, there'll be not a lot of color change, or it might look even more pale when you pull it up. Again, the Mansavahashrota, this is the muscle. So Vata enters this place, so there's going to be weakness, Pitta, inflammation, and Kapha, heaviness in the muscles. The Midavahashrota is the fat. So their Vata signs, there might be emaciation. Pitta signs, there might be a burning, like a high a metabolic issue with the fat. And Kapha, there might be obesity. Astivahashrotas, so that's the bone that the osteoporosis for a vata, the brittle bones, bone inflammation for pitta, and bone overgrowth for kapha, the maja, so the nerve in the marrow. We can look at tremors and anxiety with vata, burning nerve pain for pitta, or a sluggish response sign for kapha. And these are all everything we learned in the last module as well. It's just an overview and bringing them all together so that you've got a nice little chart for you guys. So there is this quote, an Ayurvedic quote, and it is, the body is a dwelling of many channels. Disease arises when these channels are obstructed or weakened. Yeah. And that's what we are doing as consultants or practitioners, is we're really looking at the flow and the qualities of these channels, as well as the tissues, where the vata is flowing through, not the vata, where the doshas are flowing through, where they are migrating to, perhaps if we're at that stage of disease. And really in Ayurveda, health depends on a clear flow through these channels, whether it be waste products or blood and life force energy, because when they become blocked, depleted, damaged, anything of the sorts, then disease will begin to develop. And so our role is to observe, or is to identify where and if the flow is obstructive, and then, or disturbed, and then restore that balance. So just based on what we've learnt today, we might do a just a small little case study as a class, as a group, so you can yell out your answers. And this is the case. So we're talking about the Schroeters. Okay, so Sarah, who's 42, comes into the clinic complaining of fatigue, headaches, and digestive discomfort. She also reports that she feels heavy in the mornings and has difficulty losing weight. So during your intake, you observe her stool, which is large volume, pale color, and there's some mucus in the stool. Her urine is cloudy. It has a mild sweet smell. Her sweat is moderate but slightly oily. And her breath, there's mild mucus production in the morning. So when she wakes up, she has a bit of a cough and a little bit of mucus. She has a thick tongue coating, light, slight swelling in the face, and low energy after meals. So these are the questions. Which Schroeters appear to be disturbed in this case? Do you need me to go back to the case? There. Okay. So yell it out or put it in the chat, or put it in the chat. Which Schroeters appear to be disturbed in this case?
A prana is one of them.
Yeah.
Navaha.
Pranavahashota. Perfect. And why do you say Pranavahashrota?
With the respiratory, with the breath, there's the mucus production.
Yeah.
You got the thick tongue coating, which is armor buildup in
Yeah,
that
perfect.
channel.
Yep, perfect. Yeah. Any other Schroeters we're looking at here?
The Purishavaha Shrotar,
Yeah,
colon,
yeah.
um,
And what are we looking at there?
Kapha.
Yeah, so that's my next question. Wait,
Sorry.
no, that's fine. But what you're jumping ahead.
Yeah, sorry.
What how are you identifying that is the Schroter we're speaking about?
Well, it's the stool, so
Yeah.
that's the colon.
Yes. Yep. Perfect. Um, and
Be the urine as well, yeah? Is that, do we say that?
yep,
Mm.
yep. Um, and what dosha pattern, I think Nicole's already answered this, is
Sorry.
most likely involved? That's okay. Nicole, you can answer this one. What dosha pattern is most likely involved in this case?
It it looks like kapha to me, most of it.
Yeah, and so what is the signs of kapha involvement?
In the stool, it's the large volume, all of that
Yeah,
that's listed. The urine, same thing. It's a little bit pitta.
yeah. Where are you seeing the pitta?
Well, I don't know. I thought that, but it's not. It's actually more kapha.
Or kapha? Yeah,
Um, the sweat is moderate but slightly oily, so that would be pitta.
yeah. I guess to define that, because pit sweat can be
Mm.
moderate in both pitta and kapha, we would need
Yeah.
to ask another question. Does anyone know what that question would be?
The smell?
Yeah, perfect. So if it has like a pungent, strong odor, then we would say, yeah, there's pitta involvement. Um, and if they were to say that it's sweaty but it doesn't smell much, or it's got more of a sweeter smell, then it would be the kapha.
Yeah.
Yeah, amazing, guys. Well done. Um, and if we're looking at this as a case, what lifestyle factors might be contributing to this imbalance? We don't have a lot of information about this person. We've only sort of got her presenting complaint. But if you look at the Schroeters involved, we know there's kapha in the Schroeters, then what lifestyle factors might be contributing to this imbalance?
Not a lot of
A lot of
activity,
exercise.
Yeah, yep.
So
So
she's having trouble losing weight.
lack of movement.
lack of movement. Yep.
Um,
I would say there's something you mentioned before, Amanda. There's a sign in here that's sort of telling us quite a bit about her Agni as well. And
the,
Agnis can often be affected by diet.
The digestive discomfort.
oh,
Yeah.
yes,
If
Does
you
that
are
sound
you you're talking about the tongue coating?
the tongue coating.
Yeah.
Yeah,
Yeah.
that
Yeah.
could be, well, I mean, it could be dysbiosis based on, I mean, if we were looking at the armor, which is
Yeah.
into
Yeah.
digestive issues, yeah.
Yeah. So she's got an armor build up. She's got low Agni. So what could we assume? We should never assume, but we're thinking that her diet.
Poor diet.
Yeah, and so what kind of diet would you assume, knowing that there's all these kapha signs in this person, what would you assume or guess that her diet would probably look like? What kind of foods would she be eating or qualities of foods?
Excess
Probably
sugar,
fast food.
refined carbs.
Heavy, yep,
Mm.
sugars, heavy, thick, creamies, over, and maybe too much um, volume as well. Sometimes not, because if they have like kapha in the Schroeters and low Agni and armor, then not even eating high volumes, they're just not being able to um, thermoregulate the body. So yeah, we'd want to know about her diet for sure.
Yeah.
And so with all of this in mind, so
Nutrient malabsorption as well. Sorry. Could that be
yeah,
just poor absorption too?
yeah, 100%. Yeah. And there would be because we can see that we know that she's got low Agni. And we know that Agni is really important to making the substance, from the food that then goes on to nourish all the dhatus, all the tissues. And we know that they're affected because there's signs in the different trotas. So we're looking at kapha as a sign in the stool, and the urine, and possibly the sweat. We don't sweat. We're not sure if that's pitta or kapha. Also the breath. We know the amas on the tongue. We know there's some fluid retention as well. So there's some slight swelling in the face, and we know low energy after meals, which is another sign of AMA as well, and sluggish digestion. So we're looking at a kapha imbalance at this stage. So what initial treatment strategies would help restore flow in these channels?
I'd say one of them would be making adjustments with the diet
Yeah.
to see what can, in terms of a slow reduction, because obviously depending on what it is. So yeah, so just slowly switching out things that will bring the body back into balance.
Yeah.
Suggest some gentle exercise to begin with, moving towards a little bit more vigorous.
Yeah. Get everything moving.
Yeah.
Scraping.
Yeah. Because remember also we spoke about the sweat. So that Shruta is it comes from the rasa and the midas to produce the sweat to move through the Shruta as well. So we're going to be looking at working with the rasa dhatu as well as we've got swelling. So we've got edema in her body. And so we need that sort of rasa dhatu to be moving smoothly through the body. So definitely some different movement, body manipulation. So udvatana or dry
Mm.
brushing if she's kapha. If you're going to do abhyanga, you wouldn't be doing a lot of oil. Why? Why wouldn't we be doing a lot of oil for this lady right now?
Right.
Because she's
Okay.
already oily. She needs
Yeah.
to dry out a bit.
She's oily. She needs to dry out like those. That is true. That is true. We're going with the Goonas. Very good. That also,
We do like a treatment like we did on the Bodyworks weekend where you're using the kaffir balls with the basil and the salt. Yeah.
yeah, that would be beautiful. Yeah. Um,
Yeah.
yeah. Also, she's got armor, so we don't want to be adding oil. So if there's armor, we always try to treat armor first, and we don't add more oil to armor first. So we treat the armor, we treat that and the Agni. And yes, that is because armor is the same qualities as oil. So yes, she does need to dry out and she is oily. Basically, that's what we're doing our treatment method on. See, it's so simple, Ayurveda. Uh, so we'd look at her diet, definitely be giving her a kapha sort of diet. And what would a kapha, I know we haven't done nutrition module yet, but can anyone tell me what more of a kapha uh, pacifying diet would look like?
That'd be light and maybe some chilies, some spices, and
Yeah, to get things moving.
chili
Yep,
cleanse, some
yep.
broth.
Yeah, so more lightness, absolutely, because there's a lot of heaviness going on, a lot of heavy, oily stuff going on. Yeah, so diet, movement. Obviously, when we do the herbology course, we'll be throwing some herbs that are once we've learnt those. We've said some of the body works therapies, so I like Chrissy Lee's Cuffer balls. which
Camphor
which
balls.
Helena held us. Helena's got a hand up, so maybe she wants to talk about the kapha balls or the udvatana, the gashana, the gloves, lots of different things.
I
Helena?
would say that it's also important always to try to minimize or to avoid the causative factors. So
Mm.
before thinking about the diets, the body works, and everything, try to identify the factors, the causative factors, and minimize or avoid them.
Yeah, absolutely. Absolutely. And if it's like change of season, like even now, we're going to start seeing some more kapha present in people's constitutions. And so with the weather, especially here, it's sort of been like rainy and damp and all that on off, and then hot and moist and everything. You are going to look at some constitutional shifts. So again, if the weather's out of your control, you can control the things that you're dressed in or the environments that you put yourself in as much or as best to your ability. So yeah, that's definitely a good
Yeah,
one.
and don't forget about the emotion when we talk about the factors that brings any kind of disturbance to the doshas. We should think about the emotions as being the top one. So emotions, the second one, if I'm not wrong, is lifestyle. And then, as you said, harmony, climate, and just in the fourth stage or the fourth step, the diet.
Mm.
And then it continues going to genetics and other factors, but the top one is emotion.
Mm. And in saying that, like for again, we're assuming because we have to build on this case, there's only a sentence. But when it comes to emotions, say this lady is feeling really depressed and down about her job and she's not happy in a relationship. So then she's sitting at home in this clammy climate and then she's like self-pity, dwelling in self-pity. So then her diet turns to sort of like eating comfort food. So she's having big, thick, heavy curries followed by an ice cream. And then she's got no motivation because she's feeling lethargic after the food and a little bit depressed about her life. So she just sits and she watches movies. You can see how all this just starts accumulating more and more and more kapha. And yeah, it could have started simply because she didn't manage the emotions properly at the start. So we
Yeah,
always,
and I would say, Harmony, that even if we observe, for example, that her diet is perfect, that her lifestyle is perfect, and everything looks like perfect, but during the consultation we see or we try to figure out that in her work the things are not going well. So her
mm,
emotions are not working well, I would say. So everything else won't work.
yeah, it is so true. I actually wrote about that in my book because I've had clients who come in and they've got just really low energy and just, maybe a bit of lack of motivation. And we work together and they end up having a really good diet. We fix all that. They're on great supplements and they feel heaps better. But then when they go to say this one particular client went to her job, she had no energy. Like she just had no energy. And it was because of her emotional state. And so we couldn't go, okay, just quit your job. Like we can't go, okay, you need to quit then. Like that's not reality either. We had to actually bring some more passion, some more fun, some of those opposite things to the
Mhm.
qualities of low motivation, of low energy, because it wasn't a nutrient deficient things, it was an emotionally deficient thing that we had to support. And so we did a lot of sort of mindset shifts and she made some plans for her holidays because I'm like, gratitude shifts about being grateful for having this sort of full-time income coming through where she got 6 weeks holidays a year. She's planning trips. So just doing some shifts like that before she can then go on to be like, okay, do I want to stay here or do I want to look for somewhere else to be working? And that was such a what are you drawing a nice diagram for us, Christy?
Sorry, I bumped the mouse.
Promise, that's fine. Um, yeah, so yes, it is important. We look at people holistically. We look at the emotional, the mental, the physical, the spiritual, and the dharmic health of an individual, which is very important. But you guys did all so amazing. Um, And actually, what a great time to wrap it up. So I can go to my interview because I was going to stop there anyway. Next week, we will be looking at part 2, which is evaluation and special tests. So if you liked sort of the urine test, this will be fun. We'll look at tongue diagnosis, pulse, all of that in this second part, which I love diagnostics. I don't know, it might be the nurse in me, but I like it. It's fun. But if you can, go do the urine test and observe it. If anyone would like to, I'm not saying you have to, but if anyone is confident enough to take a photo and happy to post it in the Facebook group, please go ahead and write whatever you observe so we can all learn from those observations. And I can also pop up the slide in the Facebook group if you like of the oil test. So, I mean, you got these slides anyway, but just when everyone starts writing in so we can quickly refer to it. Yeah. Amazing. Does anyone have any other questions? No, we're pretty good with our the case did really well with the case study. So everything I feel is definitely coming together and putting it all into practice is fun. It's good. Awesome. Alrighty. Well, have a lovely week. Is anyone here from, if you're not, I don't know if anyone's here from Sydney. Me and Jasmine are going to be at the Sydney. We're flying there tomorrow to do the Mind Body Expo in Sydney we've got a little booth for the Academy. So if you are a Sydney person, come and say hi. Love to meet you in person. Awesome. Alrighty. Speak to you soon,
Bye,
guys.
guys.
Bye.
Thank you.
Bye.